So for your patients with hypertension, what foods would you prescribe for them to specifically reduce high blood pressure?
Well, that's a great question. And it brings up the theme of, maybe there's like a diet for high cholesterol and a diet for disease X and Y and Z. But as you know well, it's not completely one size fits all. I mean, there's some nuances and hyper-specific situations, but in general, the diet that is helpful for diabetes, meaning the whole food plant-based one, is the exact same diet that is helpful for heart disease, and the exact same diet that's helpful for high cholesterol and helpful for intestinal issues and for multiple types of cancer and inflammation and oxidative stress, and on it goes. So it's wonderful. Like just imagine, I know this has been discussed before, but just imagine if a pharmaceutical company made a pill that could help potentially reverse heart disease, could help potentially reverse diabetes, high blood pressure, high cholesterol, reduce certain types of cancers, improve skin complexion, improve sexual function in men and in women. Imagine if there was one pill. That would be the biggest blockbuster of all time ever. But that pill basically exists. It's a plant-based diet. It's just that there's no broccoli lobby. There's no big broccoli to get the word out. So that's why you guys are so amazingly helpful. So I don't recommend a specific diet for disease A, B, or C. In general, I recommend a whole food, plant-based diet for my patients, and I'm inspired to know that that's going to be helpful for multiple issues they have. Now, that being said, there are certain times when we'll have to tweak it for a given condition, and I'd be happy to dive into those situations. So I don't mean to say it's one size fits all, but it's very, very close to that.
Yeah. I mean, on that note, with your experience working with diabetics, are there any specific modifications you would suggest so a type 2 diabetic comes to you?
Yeah. So thank you. The issue that there are there are a handful of things that come up. The big one is if they are on insulin. And so because when they eat this way, a plant-based diet, that can be very helpful for their blood sugar levels for multiple reasons. Of course, when you eat a plant-based diet, it improves the health of the muscles in your body, I should say, may reduce their fat content, the lipotoxicity there, can improve the ability of the pancreas to secrete insulin, and those things can lead to lower blood sugars. Okay, so when you eat this way, your blood sugar can fall. And if you're not prepared to know, if you don't know about what the symptoms of low blood sugar are, and you're not able to sort of navigate your insulin dose, it's possible that by eating more healthfully and with the same dose of insulin, we may push your blood sugar dangerously low. So what I do in my patients on diabetes, first we go through, okay, what are the symptoms and treatment of low blood sugar? And once we're sure we have that down, we talk about how they may need to lower the dose of their insulin, and relatively quickly. And so they monitor their glucose extra closely until we reach a new steady state. So you need to be with a partner. Not everyone can necessarily navigate those kinds of changes. So you need to be with a partner who can work with you on that. So that's the big one that comes up with diabetes. A couple of other ones that are somewhat associated with it is sometimes patients with diabetes, particularly adult onset, can have, I guess I shouldn't say that, but they could have a certain type of situation where they have a type 4 acidosis, renal acidosis, where their potassium level can be a little bit high. And if their kidneys don't work so well and their potassium runs high, eating some of the plant-based foods can really push up potassium levels. And if their kidneys don't work well and they have high potassium to begin with, that could be a little dangerous. So what I'll do, and that's by far the exception, not the rule, by far the exception. But I check a screening blood test, and if I'm at all concerned, I will check a repeat kidney and potassium within just a few days. So that's a situation. And sometimes patients with diabetes will have a condition called atrial fibrillation, and they're on Coumadin. which can be impacted by shifts in vitamin K intake. So you can very well be on coumadin and eat plants, but you have to work closely with the people monitoring your coumadin level to make sure you get the benefits of both the coumadin and the plant-based diet. But these are by far the exceptions. And the rule is that it's exquisitely helpful for multiple reasons.
You know, I love the way that you talk about the fact that if there was a medication that could minimize your cholesterol and reduce heart disease and reduce the symptoms of diabetes and reduce the complications of diabetes and help you lose weight, et cetera, et cetera, et cetera, then this would be the biggest blockbuster drug on the market. No question. Statin drugs, huge blockbuster hit. Viagra, huge blockbuster hit, right? Now, most people are unaware of the fact that a plant-based diet does every single one of those at the exact same time. So it's actually really good to hear you say it from that perspective, because I never actually thought about it as a, you know, a medication of sorts. But if you really think about food as medicine, that's truly what it is.
Yeah, indeed, you're right. And almost all of the guidelines that medical societies come out, guidelines are documents that give templates about how to practice, like how would you approach high blood pressure, how would you approach high cholesterol, and guidelines that are about those kinds of diseases almost always start with lifestyle changes. You know, exercise and eating more healthfully. There's usually a paragraph or two about that, and then 35 pages about stuff unrelated to lifestyle and medications, or lifestyle and eating, exercise and eating. But so, yeah, and I mean, with our patients, I don't look at it as prevention as either or. I look at it as all of the above. What are all the ways we can help prevent someone? And yeah, I encourage essentially every single patient to be on a plant-based diet. But we also have many patients on medications as well, because we want to use everything in our armamentarium to protect them. Now, many patients are able to come off multiple medications when they eat a plant-based diet, but we do not, you know, look at it as either or. All of the above to protect somebody.